There have been more cases or similar amount of cases in Sydney than there was in the Northern Beaches in December when they went into lockdown. So why hasn't Sydney gone into lockdown?
Marylouise McLaws, I know you were going to be in the studio with us tonight. You've decided not to. Explain why. It's to do with this question, isn't it?
It is. Given that I've been saying since last week that we should have gone into a short, sharp lockdown to keep everybody from moving around, particularly those that don't know they're infected, I decided that I need to practice what I preach as an outbreak manager.
Has New South Wales got it wrong?
I think New South Wales is loath to use lockdowns. Mostly every other state does. Outbreak managers who've had practical experience understand the adage of go in early, go in hard with very inadequate or imperfect data. And then when there isn't any outbreak, they get criticised, but often they do the right thing. So I think that this time they've had a very slow increase in numbers and then a very high peak, which is quite unusual for this variant of concern. But I still think that they should have gone into a sharp lockdown to stop people from particularly wandering over the weekend.
To Noah's question, though, when the Northern Beaches went into lockdown, there was 38 cases, I think, linked to that cluster. There's 36 cases linked to the Bondi cluster, 49 locally acquired infections so far in this latest Sydney outbreak. Can you help us understand why a different decision is being taken here?
Well, I think that with the Northern Beach outbreak, and they had 41 in total, and it took them over a month to get to zeros. I think that they went into lockdown fast because of the large numbers at the beginning, and so that they were very concerned it would be out of control, and quite rightly, they went into lockdown. It was sensible. And they were identified as being very sensible. With this one, because it went slowly and because they probably missed the boat in stopping people from wandering on the weekends, going to New Zealand, going to Melbourne, going to a party, etc. They probably feel they don't want to now, or they feel they've got it under control. But I'm concerned that that's not necessarily the case.
Yeah, do you really think they have it under control in New South Wales?
Well, no. I mean, we've had several cases that are potentially causing more harm down in Melbourne. We have the hairdresser that has been a or mystery link, as they call it. Then we've had the woman that went to New Zealand. So we're going to see more cases. They may not be enormous in number, but that's beside the point. This is a variant of concern that has a reputation for causing more hospitalisation and, of course, more children because of the large numbers of people they can infect.
All right, let's take our next question. It comes from Eric Coleman.
Just leading on from the last question, I think it sort of leads on quite well. Is the current handling of the New South Wales COVID cluster by testing and contact tracing, coupled with proportionate measures such as mask wearing, something that the other states can learn from rather than plunging entire cities into lockdown at the first sign of a positive COVID community case, as we've seen in Brisbane and Perth?
Bill Bowtell.
Well, we're here now, 18 months into the pandemic, and we are repeating, we're back to where we were, it seems, February, March last year. And by now, 18 months into this, what we should be thinking about is how we could prudently open up our borders internally and internationally, and we're not. And the reason we're not is because there's been a very serious failure of quarantine arrangements, particularly in this case at Sydney Airport, and a very poor vaccination rate. So we don't have the options that we would have if in Australia today 57% of people had double vaccinations. Only about 5% have. So we've brought this on ourselves by the decisions that have been taken that have not really kept up with the emergence of the COVID Delta variant, which is much more infectious. This was not the case with the Northern Beaches episode in Sydney or the Crossroads. It is much more infectious. And the Premier's right to say this is a very scary moment. But you can't have it both ways. You can't say it's a scary moment and we must do all of the things that we must do, testing and so on, and then think, well, it's business as usual. We can be comfortable, and this word proportionate in our response. We only have one weapon in our armoury, unfortunately, now that works, and that's, as Marylouise said, a short, sharp lockdown.
Marylouise, then, if the argument is that what New South Wales has done in the past has worked, does it still work with the Delta strain?
Well, that's a very big experiment and not one that I'd be willing to play with people's lives.
Correct.
And, Bill has mentioned that this is highly infectious. Let me remind you that the Alpha strain was 33% more infectious than the wild strain, than the Wuhan. This one is double that. So in effect, it's about 90% more infectious than the Wuhan strain. And of course, we're seeing more people going to hospital. So it's an experiment that I don't think I would be willing to play with. And yes, Bill is quite right. The quarantine system is letting us down. We've had 21,000 cases since we developed this mandatory quarantine system because of the 27 breaches that we've had. We need to shore that up, and we need to roll out the vaccine as soon as possible, but not to the Pfizer, but not to those that are anyone under 60 to 40, but to the group that are going to be more at risk of acquiring it and spreading it, and that's the 20 to 39-year-olds. They have to be our priority.
And Marylouise, the Prime Minister today dismissed that view and said that the design of this rollout is based on the medical advice. You're now at odds with the Prime Minister on this.
Well, I am. So last year, WHO provided me with the COVAX facility framework, and I went back to them and said, this is a very compassionate framework. They said, absolutely, because you're only going to get 3%, then 17%, so it has to be for frontline workers and the vulnerable. Quite right. However, that was for circulating virus, a high level of circulating virus. And I went back to them and said, but we are different. And they said, well, as a member country, you can do whatever you like. And so epidemiologists would then say, you go where you get most juice for your squeeze. And that is the 40% of cases in the 20 to 39-year-old. They are the biggest group. The next group, of course, is the 40 to 60, and that's only 24%. Now, sure, they don't have the same risk of death as those 70 and over. But if the young ones don't get it, they can't spread it. So we really need to protect the young right now.
Jayden, I want to bring you in here. You are in Queensland right now. You're joining us from Brisbane tonight because of these COVID border restrictions. You live in a state where there has been some short, sharp lockdowns and it seems a greater eagerness to lock borders down. Does it make sense to you why New South Wales isn't doing that right now, and Sydney particularly?
No, but I think that is a consequence of my own unawareness of the situation down there, in contrast to perhaps my state of being more informed about the situation here in Queensland. In Gympie more specifically, we have been very distant, I suppose, from the physical consequences of the status of lockdowns that have occurred. There's only really been, there was the start of the pandemic with the national lockdown, and then later there was a 2-week lockdown, not quite a lockdown in Gympie, but a 2-week period where we were mandated to wear masks. So that is all the contact we truthfully have had with the coronavirus. So we are quite distant from it. So having been in that environment, I possess no awareness of the situation that is occurring in New South Wales.
Nicole, you're in Sydney. Does it make sense to you?
Well, listen, you know what? I'm not going to be like everybody else on Twitter who's not an epidemiologist who gives their opinion on COVID, because we've got two incredible brains here who can do that. I would just say that some of the things to factor in, of course, we all have to behave and be grown-ups and get our vaccinations as soon as we possibly can. All of those things that we need to do exactly what the advice is telling us. But it's worthwhile just keeping in mind that when we talk about the vaccine rollout, yes, it has been poor across the board, but it's almost been non-existent for those with a disability. So that's a really shameful situation that we're in at the moment. People with a disability were recognised to be in phase 1B, and the vast majority of those, particularly those living in group housing, have not been vaccinated. So we're letting a lot of people down here.